Good morning. Good morning. Happy Saturday. Salam Syawal bagi those who are still in Syawal. Still, I think, got a few more days, very critical weekends for you to go for open house. Looking at the gems, I think everybody is still motivated to continue on that track. But for those who are joining us, and of course those who are listening into this session subsequently, it's always available on Dokiti. Thank you so much for joining us for this very, very important topic. My name is Murali, and we are with this segment, which is the latest installment of the SK Dharmalingam lecture series by the National Cancer Society of Malaysia. And in conjunction with World No Tobacco Day, which is next week, we've got a very, very special and I think eminent speaker with us this morning to provide, I think, direct from the horse's mouth, a little bit of insights pertaining to this very, 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 I hate to use the word smokingly hot topic. So literally it's membara lah. Okay, so it gives me great honor and pleasure to be able to present to you, ladies and gentlemen, Dr. Nor Aryana Hassan, who's a public health medicine consultant and senior principal assistant director of the FCTC and Tobacco Control Unit with the Disease Control Division of the Ministry of Health, Malaysia. And very often you've heard this word being used in the US. You've got people who are like put in charge, maybe the go-to person, something like how Fauci was the COVID-19 SAR for COVID-19 control and management in the US. So for us, I would call our tobacco control czar is Dr. Aryana. So Dr. Aryana pretty much heads up the unit of FCTC. For those who are not aware of what FCTC is, it's basically the kind of policy making and enforcement, the legislative unit, which is directly under kind of on a dotted line directly to WHO in all countries that have enforced this, the FCTC treaty, and of which our country is a member as well. And Dr. Nor Aryana oversees all kind of every aspect of tobacco control in this country. So we're very fortunate and privileged to have her with us today. Thank you so much for joining us, Doctor.
Thank you, Dr. Murali. Thank you so much.
Yeah. Always a pleasure to have you, especially with your really busy schedule. It's always a privilege for us to have you with us today. So, this World No Tobacco Day, what's hot in Malaysia is this. We are, for the first time, I think, looking at something called a generational endgame. And Dr. Aryana will speak to us about that. And the reason, so a couple of questions that straight away will take off the bat. Why is National Cancer Society harping on tobacco control? I think, as you all know, we've been very invested in tobacco control since the very beginning. And for us, tobacco control is one of the major causative factors for a whole lot of cancers. About 15 or 16 cancers. So we know that any effort to curb tobacco is directly an effort to curb cancer. So which is why we've always been invested in this, and why we continue to work very closely with everybody who's a tobacco control advocate, such as Dr. Aryana's good officers in the ministry, and of course other people as well. So back to this generational endgame. So what Dr. Aryana is going to speak to us today about is basically, what is this generational endgame? You've heard every single version coming out of every single industry. Everybody suddenly become a tobacco control expert, just to kind of break down the ideas about this generational endgame and tell you why it's bad. So today, as advocates, Dr. Aryana is going to speak to you, because as medical professionals, all of us are tobacco control advocates, whether we like it or not. And so the job is to perhaps get our viewpoint so that we have points to speak to our clients and to the communities that we work in at large about the generational endgame for tobacco products. So without further ado, please allow me to turn the session over to Dr. Aryana, and then please feel free to kind of put down questions, and we can address it together right at the break. So Doctor, over to you, Doctor.
Right. Thank you, Dr. Murali. Thank you so much. First of all, I would like to thank National Cancer Society, Dokati, and everyone involved in this session for calling us today to speak to you all on the latest versions of our product, the generational endgame. And I was given the task to talk about is this the end? Towards what we are going to talk about, the generational end game for tobacco product. And I will be telling you or presenting to you on the why actually we need to have this generational end game and what are the concepts of generational end game. So when you talk about smoking, and we are going to have 31st May, World No Tobacco Day, and we are talking about the smoking products. And smoking products consists of, previously is only on tobacco. But nowadays, in the new era of smoking, is no longer tobacco based. It can also goes to the non-tobacco based. And for example, through our experience in the framework FCTC sector, from the way to our office, you can we receive actually the non-tobacco base of smoking products. What I can tell you, the very direct examples is like tea leaves. So now instead of using tobacco leaves, they're using tea leaves to smoke. So that's why we have definitions of two variations of tobacco and non-tobacco. So this slide shows the global smoking epidemic as a history. You know, it has been there for decades, actually, starting from Christopher Columbus, and then it goes up to now, where there is a new forms of smoking products, as I mentioned, not from tobacco base. And this slide shows the global smoking epidemic as a history. We know, as been mentioned by Dr. Murali, why National Cancer Society is actually very interested in this topic is because of the effect of the smoking product, which was, you can see that for many years, when the Christopher Columbus came to bring into this smoking product, you can see the after so many years, then you can the epidemiology of lung cancer, the mortality start to pick up. So it's not that acute. It's not like today you smoke and then tomorrow you're going to have cancer, but it takes some times for you to develop the side effects of the smoking. So when you talk about smoking, as I mentioned earlier, we are going to divide the discussion into whether it's a tobacco product, whether it's a non-tobacco product. So why I would like to tell you this is because I would like you to relate the issues, the burden of these two, the tobacco product and the non-tobacco product, and why we should come out with the idea of the generational endgame. And from the slide, you can obviously see that these are the various type of tobacco products in the market. The very prevalent one is the conventional cigarette, rokok putih. We have cigar, we have roll cigarette, we have a loose tobacco where they use an apparatus, smoking apparatus like pipe. They also have BDs, water pipe shisha. They use an equipment to have some sort, like they call it as a shredded. It's actually shredded tobacco mixed with some liquids and some flavor, and then they heat it into the equipment of shisha. And if you can see here is what we call snooze. It's something like it's not there are various type of method you can use tobacco product, whether it's combustion, whether you chew it, or whether you snuff it, whether you put it in your mouth and you take the nicotine inside. So in Malaysia, all these tobacco product actually control under the control of Tobacco Product Regulation CTPR 2004, and at the moment our control of tobacco product regulations is under the Food Act. So in Malaysia, we don't have a standalone act for tobacco, but it is actually parked under one of the section in the Food Act. Okay, so as time goes on, you can see the evolution of the way they market the product, not only the way of use, not only the variations, as I mentioned just now, they are no longer use tobacco, they use something else, but they are also coming out with the way of how the user use it. Okay, if you look at the current conventional tobacco product, mainly as I mentioned just now, whether it's combustion, whether you just chew or whatsoever. But in this slide here is actually what they call it as heated tobacco products. So they no longer burn the cigarette, but they use an apparatus or an equipment here. It's electronic device, and they put in the shredded the cigarette, the tobacco part, and they heat it. It's something like an oven where they heat the tobacco and the nicotine will be absorbed once the user use the product. Okay, so this is a new way of marketing by the tobacco industry. Okay, so what is the current burden of smoking in Malaysia? Obviously, you can see from our data, the National Health Morbidity Survey from 2011 up to 2019, our prevalence is more or less the same, 23.1, 22.8, 21.3. If you translate it into the numbers, it's roughly around 4.9, 5 million. So what I can say is, it's actually not reducing. But we know smokers, they will come out with more complications like cancer, chronic disease, and so on. And definitely their life expectancy will be reduced. But how come the number is not reducing? It's basically because of the new smokers actually, replacing the current smokers who die early. So in Malaysia, men actually the most prevalent one. 40% of our men, they are smokers, and female only 1.2%. So what is the main issues about smoking? If you look at this slide, you can see in Malaysia, we divided the household income into categories like B40, M40, and T20, depending on their salary income in the household. But you can see obviously here, 65%, they are from the category of B40. So this is something that obviously it looks inequality between the community itself. You can see B40 has a lot of issues when they have the highest prevalence of smoking among this group compared to the M40 and the T20. So what about the younger people, the youth? So from these slides, obviously the overall prevalence from 20.2, 18.2, 14.8 to 13.2, it's actually reducing. But what we worried is actually among the female, not that. You can see not that good, because obviously you can see from the latest study that we have in 2017, it has increased to 5.7%. But this has already been 3 years, 4 years, 5 years. We're not sure what is the condition of the situations right now. But we can see obviously more female young youth smoking. And we go down for our operation smoking activity for our enforcement. We can see obviously more females among the youth, actually they are smoking, and they caught to smoke in the gazetted area. So the impact of smoking for health, not only on cancer, but you can have many disease. And at the same time, smoking is not only causing the chronic non-communicable diseases, but it can also increase the risk of infection, because we actually these 2 years we are facing the COVID-19 pandemic situation. And definitely from many studies that have been conducted in China, in Germany, in fact in US, smoking causes higher risk of COVID-19. And we had one study in Malaysia conducted last year between the 5,889 COVID-19 they were admitted to the hospital, and then we take this secondary data. So we compared between smokers and non-smokers. So we have confirmed that smokers has 2 times higher risk to get complications when they get infected with COVID-19. And this study actually consistent with the other studies from various countries. And you can have this, you can read more about these studies in the infectious journal that has been published for Malaysia study. So what about the treatment costs for the complications of smoking? So this is an old study by Professor Said Al-Junaid in 2007. He calculated the cost of treatment only for 3 diseases, the one that I show you from head to toe, but this is only for 3 diseases like lung cancer, heart attack, and COAD. And he has divided it into the cost for government and the cost for patient. And the total cost, if you calculate here, is roughly around 3 million ringgit Malaysia. This is the calculation in 2007. And we have been doing the projection for the cost, and based on the study in 2007 and based on the prevalence of smokers, 5 million in 2005, we have calculated the total cost for the country to be roughly around 8.77 million ringgit Malaysia by 2030. So this is something that, sorry, this is not million, this is a billion. So this is, you can see we have quite a number of burden in terms of the cost to the smokers. I'm so sorry, this slide actually the ringgit Malaysia is not a million, it's a billion. Okay, so if you compare between the treatment costs versus the tax collection, whether untung or rugi, whether you actually get a positive profit or actually a net loss. So this is something that you often heard from the smokers. They said they are the tax payer. But looking at this graph, looking at this study, looking at this estimation, the total cost, as I mentioned just now, roughly around 6.21 billion, and you compare to the total tax collection, and definitely that's a net loss of the country. But bear in mind, this is only for the 3 diseases that I mentioned. So every year, what they collected is actually more that we spend for the treatment for the complications of smoking. So we talk about just now, when I talk about the prevalence, the prevalence is not really reducing. And I was mentioning to you just now about the new smokers. And it is correct, during the National Health Mobility Survey, the prevalence among the younger person, the productivity group of people like 20 something up to 40 to 45 years old is actually very prevalent. So this is very alarming or very disturbing, because they are in the productivity group. So these are the studies that shows the loss of the productivity in ringgit Malaysia. You compared among smokers, whether ex-smokers and non-smokers. The productivity loss means that they can't come to work, the absenteeism, they are actually sick, and they are also looking into this study, also looking into they have to stop while working, they stop and try to go somewhere for puffing and all that. So all this has been calculated, and it shows that smokers has a higher productivity loss compared to the non-smokers, and of course compared to the ex-smokers. And this study shows days of not well, whether they are sick or not. So you compare between smokers and non-smokers. So smokers has a higher mean days for not being well. So eventually, as a conclusion from the complication, you can see obviously smokers, as I mentioned, they will end up in premature death, but the other 30 will go on into a lot of complications and other morbidity as mentioned. So this is happening in the market. You can see a lot of tobacco product. So in Malaysia, if you go to all the open retail, a very nice marketing, in so-called indirect marketing. And the latest one that we can, this one is you swipe on the box, and then you smell, so that they put in the perfume here on top of the box. So this is something like is still happening, and we are trying to control the issue of especially in terms of the marketing. So this is at the point of sale. So you can see obviously that a lot of issues, yeah? And it's very attractive to our teenagers, to our children when we come to, for example, like 7-Eleven and so on. So you can see obviously this is something that in indirect promotion to attract people, to attract the new smokers, to attract children actually. So in terms of the packaging itself, Malaysia is not still, we are not like New Zealand, Singapore, in fact, like Thailand, they are actually implementing the plain packaging. But for us, we still are looking into implementing those control. But these are the issues you can see very on the box, yeah? Very attractive pattern on the box, and the very what we call very descriptive, the descriptive, like #1 charcoal filter and something like that. So it's actually attract more smokers, more people to start smoking. So this is another example where if you can see when they buy the tobacco product, they can get free paper and they can roll by their own. So obviously you can see RM5.90. It's very cheap. No? So even KFC you can get, you cannot get RM5.90. And as I mentioned just now, we have a new way of smoking. Not only the conventional cigarette, but they are now using what they call it IQOS. And then we have also another variations of heated tobacco product in the market new. I think you can see this in the market. There's a lot in the market. And so this, as I mentioned just now, this is the device that has been used to heat the tobacco product. You can see obviously, if you go to many shopping malls right now, that's very obvious and very nice. It looks like, you know, it looks like electronic shops, but you don't know. You go there and then you can see, oh, this is tobacco product instead of an electronic. First, when I saw this, I thought it's actually a handphone shop, but it's not. It's actually the tobacco shop, and very cheap. You can see RM99. You can get the device, and you can buy the product within around RM17. So it's fairly cheap and it's still affordable. Okay, so this is another example. All right, so when they come out with the product, the new product from combustion type of product to the non-combustion product like heating product and so on, they also come out with a very fancy campaign like Unsmoke Your World. So I'm not sure whether you heard about this campaign or not, but bear in mind, this is not Ministry of Health campaign. It's mimic like they are actually like supporting us to create the unsmoke the world, but they are actually trying to channel the user of smokers, the conventional smokers, to the to the heated tobacco product that they have. Very, very, very tricky here. Unsmoke your world. If you don't smoke, don't start. If you smoke, quit. If you don't quit, change. So change to what? Change from combustion to the non-combustion product. So these are all the things that we have been dealing with, and we are trying to really control under the control of tobacco product regulation, so that we can make sure it's not really attracting. We must make sure that the new smokers, the very important thing is the new smokers and the youth will not be involved in smoking. So this is another example of marketing. Okay, now I go to the second variations of the tobacco product, which is very, very, very prevalent right now, and it's very popular, and it's actually an electronic cigarette or vape. So I think most of you know that sometimes they call it as e-cigarette, sometimes they call it as vape, but now the latest generation that we have, they even call it like pod. You can see people hanging here or hanging at the handbag and so on. So electronic cigarette originated from China. It's brought in Malaysia since 2013, but it's already become a phenomenal issue since 2015, and we had quite a big war with the industry in 2016. This is because the electronic cigarette, they have many variations. Okay, you can see from 2007, they just look like a cigarette, like cigarette, just like it resembles cigarette, but it doesn't produce more vape. They call it like vapor actually. The vaporized is not as many as this type of e-cigarette. So then you can see the evolutions of the e-cigarette, getting more attractive. Just now we have the issues of tobacco product where it's very attractive with the colorful and so on. On top of that burden, we have the issues of electronic cigarette where you can see the packet, the way of the change the way from the big one up to the small one, and it's very easy to use. This is the latest one that I found in one of the enforcement that we conducted in one of the state. It just looks like ice cream, the packaging. You can see the ice cream and the liquid is inside here. And you see very, very, very fancy cartoon packaging. And this is something that, is something like they put it as a straw so that it looks like you actually not smoking, but you looks like you are drinking water from the straw. So a lot of variations in the market. Okay, so again, okay, this one you can see the pink color one, Alba, blue color one, and the green color and the purple color. This one is very prevalent among the youth, among ladies. They are, as I can mention to you here, during our enforcement activity, we actually issue compound quite a lot to the ladies who usually they like this type of e-cigarette because they smoke in the restaurant. Actually, the restaurant is a gazetted area for non-smoking area. So this is very worrying. Okay, I'm not sure, as I always mention, I'm not sure if my menantu, what we said, the ladies, not sure whether in future, if you don't stop this, your wife or your even your son will bring in daughter-in-law bringing this all vape carrying on. So it's a very trendy right now. They don't feel shy. They are openly taking or vaping in public. So what is the burden actually comparing from the tobacco conventional cigarette? So you can see from the prevalence that in my slide here, roughly around, as I mentioned just now, the prevalence for conventional cigarette is not reducing. Yeah? But what worries us here is the orange color graph, where in 2016, as I mentioned, that the phenomenon of vaping started in Malaysia, there was 3.2% in 2016, has increased to 4.9% in the latest data that we have, that was in 2019. So if I can translate into number, so roughly in 2016, we have roughly around 600,000 people smoking, and it has increased to 1.2 million. So, so many people actually now take up a new way of smoking, not the conventional cigarette, but towards the vaping. But whether they are actually shifted from here to here, we are not sure. So we have to conduct more study to prove that. So this is the prevalence among the youth. So you can see, obviously, in 2016, there was 300,000 students aged 12 to 18 use e-cigarette. And this is the one of the study conducted in Kuala Lumpur, where they noted that in the schools, in the secondary schools in Kuala Lumpur, 42.2% use e-cigarette, 30.8%, they are actually dual user. They use both tobacco and e-cigarette. And what worry us, they are from the B40 group of family. So this is something that we really have to look into on how we should really fight, not only the issue of the conventional cigarette, but the new era of smoking of e-cigarettes. So again, you can see the comparison between these 2 years. So this is the prevalence of e-cigarette among youth. So it's obviously increased. And this study was in 2017. As I mentioned, I do believe it's already increased right now. So you can see this in the internet and so on. People start to share the habit of vaping with their children, and it's something like it's a new norms to them. So what is the difference between the behavior of vaping and smoking? The study shows that mean frequency of the e-cigarette user roughly around 19 sessions in a day, and roughly one session, mean puff for e-cigarette user for one session is 16. So that means once they use the e-cigarettes, so around 16 puff, they stop, and it will continue until 19 sessions in a day. When we ask what type of flavor that they like, whether it's a flavor or not, so roughly people like the e-cigarette because of the flavor. So a lot of flavor in the market now. They divide it into fruity flavor or creamy flavor. Creamy means like, they put in vanilla and vanilla coffee and etc. But the fruity flavor like mango, strawberry is very preferred among the younger group of people. So what is the content of e-cigarette actually? Whether it's safe or not. So basically, in the liquid, it's actually the content includes nicotine. They will have propylene glycol, they will have vegetable glycerin, and they will put in flavor. So whether or not they can they exclude propylene or vegetable glycerin? Yes, but they are not going to produce vapor, because propylene glycol and the vegetable glycerin is actually the compound that will produce the whether it's a lot of vaporized or not. So this is the 4 main content in the e-liquid. And the problem with nicotine, if you compare to the other substance like heroin, cocaine, alcohol, caffeine, and cannabis, we have different types of addiction, like withdrawal, reinforcement, tolerance, dependence, intoxication, addiction, and so on. But nicotine, once it hook to you, you are very attached to that. So it's very difficult for you to let it go, to stop smoking and so on. So this is really very worry, because when the person at the early stage, when they start smoking, when they start to, whether smoking or vaping, they will be very they will gonna have very difficulties in stopping smoking or vaping. So this study shows that whether e-cigarette and cigarettes is actually, whether they can change, whether it's an alternative, whether e-cigarette is actually an alternative to cigarette. If you ask me, and if you ask the expert, it's not, because of the way of the nicotine absorptions is actually very resembles to the way of absorption to nicotine to the brain. So for cigarettes and for e-cigarettes, the minute you inhale the smoke or the vapors inside to your lung, it goes to your blood and it goes to your brain. It takes around 10 seconds. So it's actually it's only a new way of addiction, rather than you can if you're a smoker, then you change to this one for a better, less harmful product. It's not, because the way of addition is still the same. So if you look at this slide, basically when you look at the flavor, the glycerin, the propylene glycol, is actually something that we use in the food, kan? In the flavor, like vanilla flavor, the strawberry flavor, we put it in when we bake, in the cakes and all that. So actually these three products, or these 3 or 4 products, we classified it as GRAS, generally recognized as safe, but definitely generally recognized as safe when you eat it. When they put it into the mouth, it goes into your stomach and all that. However, in these situations of vaping, it's actually you heat it and you're not sure. It's no longer the glycerin, it's no longer the VG that you inhale. Is actually the end product of the process of heating, and it goes to your lung. And through our the anatomy of these two systems is actually very different, and definitely it causes a lot of side effect if you compare to this one. So we used to know, people always say that, oh, VG flavor is safe. Yes, it's safe, but it's not for inhalation, but it's only safe for eating, or you put it in the food or so on. Okay, so these are the side effects. There's a lot, okay? So when you heat the product, there's a lot of intermediate chemicals that will come out, and it goes into your respiratory system, and it affects the whole of the respiratory system. So you can see from the slide here, there's a lot of studies that shows not only PGVG or nicotine inside the liquid, it's not safe because of the chemical product that produce, and you inhale it into your respiratory system and cause a lot of effects. So these are one of the study, a systematic review on the electronic cigarettes. So 175 studies were identified, and they compared to all the studies, and they show that none of the product were free from anything. So when they put it in the heating, even if they don't heat it, so even they put it in a bottle, the reactions of the chemical will produce a lot of toxic compound. Another conclusion that they found, that in vitro studies, so there's a lot of inflammation, stress, and all that to the cells of the in vitro studies. And then they also go on into experimental studies. At the moment, they have noted on the short-term effects. But of course, as I mentioned earlier, it takes years, 50 years, 60 years for the tobacco conventional cigarette to see the effects of cancer. Definitely for this e-cigarette, you have only the acute effect. We have to wait for a longer time for them to develop a longer effect. What about the exposure to vapor? Is it the same with smoking? Secondary effect of smoking is still the same. Studies have shown that indoor air particles, they still produce indoor air particles, and if you vape, besides your children and so on, they are also inhaling the same toxicants or chemicals compound produced from the vaping. And this is the most very important point. At the end of the day, you heard about the less harmful product. You heard about let's change to e-cigarette. E-cigarette can help you to quit smoking. E-cigarettes, compared from cigarettes and the e-cigarettes, cigarettes has a lot of tar, lots of carbon monoxide, and for example, and so on, compared to e-cigarette. But at the end of the day, you can see they are actually not really go on into harm reduction. In fact, 80% of those who change from conventional cigarette to e-cigarette, they land up as a dual users. So starting from the vaping, as I mentioned in 2013, when they start to have these issues changing from conventional cigarette to vaping, and then we start to look into whether there's a side effect of vaping. And in 2019, 2018, just before the COVID-19 came into the picture, in US, they found the outbreak of EVALI, electronic vape associated lung injury. As I mentioned just now, the content of the vape is not only the liquid, but the reactions of the chemical cause irritations to the epithelial lining of the lung. So this is what we call as EVALI, electronic vape associated lung injury. In Malaysia, we have very bad, very severe case, two cases, one in Labuan, one in Kuching, involve, this one is students actually, both they are student. Very bad, they land up in ICU. In last year, actually, we have been working together with PPUM and WHO, so we have roughly around 60. So right now, my division is actually trying to start to have reporting systems. All the EVALI cases will have to be notified to the disease control division so that we can monitor the effect of the usage of electronic cigarettes in Malaysia. So what about the cost of EVALI? So roughly, has been estimated here, the cost of 4 days admission is roughly around 50 ringgit, 50 million per person, 50 million. And the average admission for EVALI is around 12 days. So it's actually the total of the cost for treating EVALI patient. For one patient, it goes up to 150 ringgit, 150 million per day. So it's actually it's a lot. If you compare to the conventional cigarettes, it's even more. And you don't have to wait for 40 years, 50 years to get EVALI. You can get EVALI within 1 month using of the e-cigarette, within two months, even a year, and so on. Through my experience for the 2 cases that I mentioned, these students actually, they change from fruity type of flavor to creamy type of flavor, because they say it's like, a very nice taste. It's just like, you eating McDonald's ice cream and so on. So they really like the taste, and they puff and puff and puff, and they land up with EVALI. So this is the projection cost for treating EVALI. But this is very underestimate. If you can see here, we calculate the number of EVALI, estimated EVALI, roughly 0.04% on the incidence rate. Very, very small. So you can imagine in the market, or with a lot of various variety in the product, people get more attracted, people get more excited, and people will puff more. So I can estimate if we don't control on this usage of e-cigarette, you will have more number of e-cigarette users, and you will have to have more incidents, and definitely the cost of to treat the EVALI will be higher. Okay, whether it's safe alternatives or not, I have clearly mentioned to you. I have, I think, elaborate a lot of why we say that this is not safe alternatives. It's just not because of the flavor. It's just not because of the PG and BG, but it's interactions of that product itself. And when you heat the liquid, it'll produce more toxicants, more chemicals, more we're not sure whether carcinogenic or not, because we have to wait. Of course, there's a lot of carcinogenic chemicals that will produce when you heat, but whether it will end up with cancers or not, we still have to wait something like 40, 50 years, like the conventional cigarette. So it's just not to say whether it's safe, definitely. So WHO has come out with the report, and WHO has mentioned that it is not a safe product, it is not an alternative product, and in Malaysia, the policy of less harmful product is still not acceptable. I can say that it's still not acceptable. And this is the study in Malaysia being conducted by University Technology Malaysia. So this one of the chemists, they analyze them, and then they can see a lot of chemicals. So obviously you can see it's not actually only about PG, VG, and flavor. It's actually when you mix it around or you heat it, it will produce a lot of chemicals, toxic chemicals, carcinogenic chemicals, and so on. Okay, so this is happening right now. A lot of marketing strategies. You can see cabaran7hari.com, perubahan pada tangan anda. They ask you to change from the conventional cigarette to cigarettes, and a lot of issues about the quit smoking. They even put it as a good for quit smoking. So we have a lot of reports. As medical person, we must go for evidence-based. We don't go for testimony. So evidence-based shows that it is not for quit smoking. And this is the one that I mentioned, WHO technical report, just recently, 2021. The one that I show you in the slide, that it's not safe, it produces inflammation, it causes secondary smokers, effects to the person surround you when you vape, and so on. So a lot of things that you can search for these WHO technical reports, and you can have more evidence here. And in terms of the harm reduction for us in Malaysia, we go by evidence. You have to go for your clinical trials. If the product is for quit smoking, you have to register it as medicinal product to look into the safety, efficacy, the cost, the prescriptions, and so on. So this is happening in Malaysia. The vape shop is all over the place. They even put up the tents like this, when you sell nasi lemak kuih, something like this, in one of the pasar malam. They have a very attractive way of promoting the cigarette, the export. Even the professional bodies, the professional person, they also involved in promoting or in talking about the vape. So I hope from the slides here or from my explanation, and please read more about e-cigarettes, that you have a better idea whether it's really a harm reduction, whether it's really, you can promote whether it's actually good for quit smoking or not. So because of all this problem, so because of the issues of the double burden that we have, as I mentioned, we have a lot of problems with tobacco conventional product, but now, which even worse, the new things coming in, and people even use both of them. So that's why we have a problem in terms of controlling and enforcing the situation. You can see a lot of marketing of electronic cigarettes in the online, on the billboards and so on. Why? It's because the current act that we have right now, they cannot control the non-tobacco product. It's only control the tobacco-based product. So that's why we are in the, actually, I can say in the final stage of coming out with the new law. And our Minister of Health, YB Khairi Jamaluddin, has already announced in order to curb the issues of the smokers, vapors among the young generation. The Ministry of Health has already announced to propose Malaysia to ban cigarettes for anyone born after 2005, and this is what we call as a generational endgame. And what we try to achieve by doing this, by having a two segment of people, one group of people can smoke, another group of the young generation actually they are barred from taking any forms of smoking habit. We try to, at the end of the day, try to achieve the prevalence of 5%. Why? We want to reduce the burden of cost of the cigarette. We want to reduce the burden of cost of EVALI. We would also like to reduce to improve our productivity, the loss of productivity, and so on. We have this policy in Malaysia. We, as I mentioned just now, we are in the process of strengthening the law. We are coming out with the new law, standalone law, to curb both issues of tobacco and non-tobacco product. So this is the thing that I mentioned just now. We divided into two groups of people. The generational group of people, whoever born, anyone born on 2005 onwards, and the non-generation band of group of people, anyone born 2004 and below. So I do believe all of us here today belongs to the non-generational band group, but don't worry, because roughly we have only 20% smokers, 80% majority, they are not smokers, but we must make sure the majority of 80% don't go to vaping, because they thought that vaping is safer and it's a new trend and so on. And looking into this PowerPoint in the slides, you can see obviously the industry is not happy with this suggestion, and looking into the life expectancy. The business, they can go on up to 56 years, comparing with this group of people. But definitely they know that the client will die early, so roughly around 30 years. So we really hope that this suggestion will be accepted in the parliament soon, and we hope that you can also support us in going up to fight for the generational endgame. And with that, I would like to thank for your attention, and I will open to any questions from the floor. So Dr. Murali, over to you. Back to you. Thank you.
Thank you, Doctor. Thank you for that. I think very comprehensive kind of insights to us on this. There are a couple of questions, Doctor, if maybe we can start fielding them right away. Okay, lovely. And ladies and gentlemen who are on this session, please feel free to kind of drop your questions as well so that we can look at them. Some of them are coming directly to me, so I'm fielding those questions first, but feel free to drop your own questions and we can ask them. Doctor, so the first question is, I think from one of our colleagues, are we looking at enforcing this ban, how in practicality, when people are coming to us after this 2005 ban is in effect, let's say there are already people who start smoking. What are the alternatives that we can offer to them at that point in time if we are not going to offer them to be able to vape or reduce? So do they have to quit cold turkey?
What is the offer, right, Dr. Murali? What is the alternative for them if we don't? If we said you don't take, you please stop smoking, don't take vaping. So what are the other alternative?
Yes, doctor.
And if they are already involved with smoking or vaping, actually, the Ministry of Health right now has been, we have been starting to promote, actually to launch what we call Gegar 18 generation. So this program is actually mainly to make sure the generational group, we call it as GEG group, who has involved in smoking, we are trying to treat them, okay? And the universities, the workplace, and also the open public, so that when they go out, when the law enforcement support to continue not. So this is what we have been doing. But in terms of the implementation, probably I misunderstood the question, but in terms of the implementation later on, in terms of the enforcement, definitely at the moment, 18 years and below, they cannot buy cigarette. So the retailer, they must actually ask for cigarette, for IC. So the practice will carry on, but definitely the Ministry of Health is actually looking into ways of like digital and something that we can implement more lah. Okay.
Okay, got it, doctor. In terms of, okay, there's another question, I think, in terms of, is there any kind of new vape cessation punya program that is out for like, for example, primary care practitioners and all that, to be able to train on, so that we can, now offer vape cessation as like a intervention to our patients?
Yeah, the treatment for nicotine addiction for conventional cigarette and e-cigarette is the same. It's just that there is a new way of based on numbers of cigarette and all that, right? But for e-cigarette, we base on the number of puff and all that. So the treatment is the same, but of course, the way of we assessing the nicotine addiction level will be a bit different. So we have already the module on the way of actually assessing the nicotine addiction level. But of course, the treatment of the nicotine addiction will be the same, like the NRT, the gum, and modification behavior and all that.
Okay, got it, doctor. Doctor, there's a question on, is e-cigarette having similar side effects to secondary smokers as conventional cigarettes?
Yes, I know I have showed it from one of my slides. They produce a very fine, as I mentioned in my slide, the vape is not only the water, it's not only water, it's not only the flavor, it's not only the banana flavor, chemicals. So when it produced a very fine particles outside, and the study has actually proved that you can go to the people surround you, and the secondary effects is the same as the conventional cigarette. Yes.
Okay, got it, doctor. Doctor, there's also a question on, is there any mechanism that we can use to determine vape usage? I believe we talked about like carbon monoxide assessment for smoking, or even the use of macam saliva tests to see the amount of smoking usage? Are there these kind of tests for vape?
Okay. For cigarette conventional, because it's a combustion, so it produces carbon monoxide. So for e-cigarette user, if you use carbon monoxide analyzer, you won't detect CO because it's actually heating. It's not a lot of CO. So I used to use before COVID-19, we used to have this carbon monoxide analysis for the conventional cigarette. You can't use a CO analyzer, but what you can use is basically history. Definitely, you must have history, and you can use a nicotine level. That one you can use even in urine, in saliva. Quite expensive to use it as a screening. So that's why we still go on into history and any other screening method that we have in the market, saliva, blood, or one more thing, urine. Yeah. So you can't use CO analyzer because it shows like you are a non-smoker. You cannot. Yeah.
Doctor, and I'm sure like there's how does it work currently in terms of if we as a physician, we start to see patients who feel that they want to quit smoking, but they are transitioning into vaping. Is there any other kind of resources we can draw upon, like the MQuit program? How do we get onto this? How do we refer patients?
Okay, if you happen to find that this type of patients, and I do believe there will be a lot, because they want to quit smoking, they don't know where to go, and the e-cigarette specialist is all over the place. Come, and I can help you to quit. So what you can do is you just ask them to log into www.jomquit.com. Then they can get a lot of information into this jomquit.com on how they can embark into the program of Nation Quit Smoking Services MQuit. We have right now offered them as online services as well. They can come as online, but they can also chatting into this the platform of www.jomquit.com. So there's a volunteer actually in the platform. You can chatting, and you can ask your patients to chat there to ask more information about how they could quit smoking, what is the side effect, why we say that e-cigarette is still it's not less harmful, and so on.
Okay, got it, doctor. And of course, as I was saying earlier to our colleagues, one of the kind of services that I think all primary care practitioners, even respiratory physicians, we should be able to offer these smoking cessation services. It's not too complicated. Doctor, if I recall, the ministry has got some modules that we can license ourselves online. How do we do that, doctor? Any that website we can go?
Okay, for those who, for the practitioner outside there, if you are interested to join us into giving the services of quit smoking, and if you would like to be accredited by this program of MQuit, you can always go to the jomquit.com again, and there will be a one segment for providers. You can link into that, and you can try to look into the various training that we offered to be a good person to actually give the services of quit smoking program. We have two, CSSP from Malaysian Pharmacy Society, CSSP training, and another one is Scope from UMCAS, or University Malaya Addiction Center. So you can choose one of them. You can take the course, take the exam, Viva of course. So once you pass level 1 and level 2, you can join us to be one of the MQuit provider, and we can in terms of the promotions and activity, we are going to do it as a group of MQuit program. Yes.
Okay, and that is good to hear, Doctor, because that will, I mean, to our colleagues, I think it's a good way to strengthen our capabilities as well as to, you know, offer these kind of services to our communities, our clients all around us, because this is the sad reality. Bila we tak offer, somebody who's basically on working in an e-cigarette shop is putting themselves forward as a smoking cessation expert and getting people to not quit smoking but switch on vaping as the kind of modality for them to, you know, coming out of this. Okay, so Doctor, if I understand correctly, we have a video to play as well.
Yes, Dr. Murali, as the end of the session, we would like to share with all of you here today, the participants, the video by our GEG group, where their voice, they want the generational endgame to be enforced as soon as possible. I think I really hope that this gives some insight to all the participants today to come together with the Ministry of Health to support the force of the GEG.
Okay, Doctor, just before we play the video, maybe we can finish with that video. Just a little bit of housekeeping. Please allow me to, again, on behalf of National Cancer Society, thank you so much for joining us this morning. And for all you, ladies and gentlemen, for joining us this morning as well. Please get your CME points sorted out. And before we end, we'll kind of end with the playing of the video. I want to ask Dr. Aryana, Doctor, do you have maybe some last words for you to share with us this morning?
Okay, to all the participants today, as a professional, we must go by evidence. Please come together. We know that at the moment, the Malaysian policy is not accepting the harm reduction at the moment. But of course, by evidence, if the e-cigarette is actually good for quit smoking, they must register as medicinal product. So please support us, and please also support us on the GEG. Thank you.
Okay, thank you, Doctor. So, ladies and gentlemen, thank you so much for joining us. We're going to end with this video as that's being played, and then we're going to call it the end for this session. We'll see you next month with another session of SK Dharmalingam. So, thank you very much and have a wonderful weekend. Doctor, I think shall we put on the video?
Yeah, thank you. See you.
Malaysia would like to highlight the negative impact of tobacco on NCDs, which is well known. We, like some other WePro countries, hope to pass a legislation this year which, if successful, will bring about a generation endgame to smoking by making it illegal for the sale of tobacco and other smoking products to anyone born after 2005. Malaysia feels this will have a significant impact in preventing and controlling NCDs. Thank you.
Saya sokong GEG. Saya sokong generasi penamai. Sokong GEG. Saya sokong GEG. Saya sokong. Saya sokong. Saya sokong GEG. 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 Kami sokong GEG. Saya sokong GEG. Saya sokong GEG. Hai, kami sokong GEG. Hai, nama saya Takif. Saya sokong GEG. Hai, nama saya Iman. Saya dari Sabah. Saya sokong GEG.
Saya sokong generational endgame.
I support GEG.
Saya sokong GEG. Generational endgame. Assalamualaikum warahmatullahi wabarakatuh. Hai kawan-kawan. Saya Lutfi dan saya Mariam. Kami sokong GEG. Saya sokong GEG. Saya generation endgame. Saya sokong GEG.
Saya Amir Ifai. Saya 14 tahun. Saya sokong GEG.
Kami sokong GEG.
sokong GEG. Saya sokong GEG.
Saya sokong GEG.
Saya sokong GEG. Saya sokong GEG. Saya sokong GEG.